Welcome, David. Really looking forward to talking to you today about NHS IMPACT, some of your experience of leading improvement over the last few decades and the role of Q. We've known each other for a long time.
We have, and it's great to meet up again, Penny. And yes, it was a long time ago, the modernisation agency, but it's been really good to work with you in other roles since, particularly when I was at Aqua and all the work we did with the Health Foundation, particularly to get the Q community off the ground in the early days too. So yeah, it'd be great to have this conversation.
You've been a source of inspiration throughout the last few decades, and I know not just for me. David, you've spent your whole career leading improvement at different levels. How have you seen our approach to improvement change over the years?
It's evolved and grown and developed and improved. So, the great thing about working in improvement is you need to improve your own work, improve the way you do the improvement. And I've definitely seen that over 40 plus years, I would say. It's quite interesting because I joined the NHS in 1989, having had a decade in manufacturing first, and was pretty shocked to find that we weren't applying improvement consistently, systematically to healthcare. And the modernisation agency was perhaps the first time we'd really done that. And yeah, it was an amazing time and an amazing experience. Obviously, a lot of new resources coming into the NHS then on the back of the NHS plan, but linking that to really embedding improvement. And we trained in the space of 4 years, 100,000 staff, 10% of the NHS in improvement. Some fantastic results through Emergency Services Collaborative, Action on Orthopaedics, Cancer Collaborative. And a lot of that capacity and capability is still out there in the NHS now, which is terrific. But it kind of feels like now's the time for that, renewing that national approach to improvement once again, which is what we're aiming to do through NHS IMPACT.
What would you like to see from the Q community when it comes to realising the opportunities of NHS IMPACT?
I was involved in conversations right at the very outset about Q before it was even called Q, and it's been fantastic for the NHS. And I know many people who've grown a lot personally, who've gained so much by connecting with other colleagues, building those communities of practice. We absolutely want to see that continue. I think what I would say is I would like to see Q even more aligned to the big priorities that we've got, really applying the learning and the expertise. And that's partly about the QE community. It's partly about NHS management recognising what we've got there and the potential of it, and not just taking that traditional management, programme management style approach to productivity or flow or workforce challenges, but really saying let's use an improvement approach, and the key community can bring fantastic expertise and wisdom into that discussion.
Q and the Health Foundation is working in partnership with NHS Confed to support learning improvement across places and systems. What's the priority for systems, do you think, when it comes to improvement and to NHS IMPACT in particular?
Well, as you know, Penny, the NHS IMPACT's got 5 really important domains, which are the DNA of any improvement culture. So building shared purpose and vision, investing in people and in culture, developing the right kind of leadership behaviours, using a robust improvement method, and then embedding it in our management systems and our daily work. I think all 5 of those are just as important at the system level, but we need to apply them differently. And the 2 things that I would pick out as really critical is that shared purpose and vision across agencies, getting local government, the voluntary sector, acute hospitals, community services, mental health, all around a table to say, what is it we need for this place? What does Blackburn need for its population going forward? And then really developing those system leaders, people who can build alliances, who can work to influence and persuasion, not just the power of the hierarchy behind them, building the relationships and getting people to work together. And then the improvement methods will come and will follow on, but we've got to get the vision and the leadership and the culture right first.
Q spans the UK and Ireland, and we've seen real value in learning and sharing across countries. What have you seen over your career in terms of the benefits of learning across kind of geographical country boundaries?
It's been immensely valuable. I mean, both here in the UK and more widely, and indeed, I would say learning from other sectors too. So back during my time when I was chief exec of Aqua, the Advancing Quality Alliance, from 2010 to when I sort of retired in 2019. As you know, Penny, we did a lot of work with colleagues up in Scotland especially, but with the 1,000 Lives programme in Wales, with colleagues in Northern Ireland. And the systems were all a little bit different, and learning about the differences, I think, helped us all be stronger. I sometimes think as well, we're not imaginative enough at looking across into other sectors and seeing what we can learn there and how we can adapt and apply that for healthcare too. And certainly when I was chief executive at Bolton Hospital, we had all kinds of external partnerships. Warburton's Bread, who are based in Bolton, are a lean bread manufacturer. Did you know that? And you wouldn't immediately say, well, what can we learn from running a hospital? But we sent teams there and they came back and applied that learning and adapted it. And it gives that spark of innovation when we can do that.
What do you think the role of Q can be in supporting innovation in the health service?
I do think when we talk about scale and spread and adoption, we sometimes assume we know everything and all we've got to do is get it all out there. And I don't think that is the case. The world is moving on and changing. Some of the really complex, wicked problems that we've got now are people living with long-term conditions in the community, multiple comorbidities, who need maybe many hospitalisations in the last years of their life. We need some imaginative new thinking on that. I'd like to see us develop a series of innovation hubs, developing some of that new thinking. And again, I think Q can play a really big part in there. I've met lots of members of the Q community. They're often at the forefront in thinking, in their own trusts, in their own systems, and getting them to come together and to really think about the design methodologies that we can use, how we hothouse some of that innovation, then linking that to the spread and scale and adoption practices that we've got. That could be really powerful and could put the NHS right at the forefront of thinking in healthcare about how we're moving that forward.
So we're there to help share, learn and collaborate around the what of some of the big challenges, but also at the same time really bring that creativity and innovation to how we tackle these big complex challenges. And thinking about some of those big kind of challenges and opportunities around digital workforce, what do you think the opportunities for improvement will be over the next decade and beyond?
So I think the first thing we need to recognise is that the big national programmes are great. We could go back to some large-scale collaboratives, but actually they have to be then landing in a receptive context. We need local systems and cultures for improvement in every provider organisation, every place, every integrated care system. So the first big opportunity is to work to build those self-improving systems. We've seen with the 5 trusts that were part of the Virginia Mason programme, for example, the fantastic results that they are delivering. We need to see that more and more across the NHS. But then linked to that, I think we need some big national programmes that are tackling the most pressing issues. And anybody who's had somebody admitted to hospital will know it's often great care when you get in, but getting in through the urgent care system is really difficult. So improving flow across the system, emergency flow, elective flow, I think is the most pressing priority and one that we really need to tackle.